So now I'm happy Dr. Vyasa Immadisetty is also available for question and answer sessions. So just brief introduction. Dr. Vyasa Immadisetty is MBBS and MRC Psychiatry is a consultant psychiatrist from United Kingdom. Thank you, Dr. Vyasa, for your availability for this session, despite having a difficult times. So now I'll proceed with question and answer sessions along with Dr. Madhavi. So first question, uh, how do we differentiate the level of eustress from distress subjectively for a doctor? Dr. Anurag Srivastava, sir.
Basically, eustress is, we talked about it briefly in the presentation, that initially what happens is that I would say that the distinction is when the stress is at a level which overwhelms our coping ability. That stress then becomes distress. So initially, when a person is put under some stress, they will rally their resources. They will try to problem solve it. They'll try to get hold of friends or support and try to solve the problem and do the things which are required to do it. But the psychological and the physiological response that the body mounts against the challenge or the stress, if it goes beyond a tipping point, and that tipping point is different for different people, it's genetically determined, it's temperamentally determined, some degree of the culture and the upbringing that you have, all of these things give us the resilience. They give us a different tipping point. But once the tipping point is crossed, then the psychological and the physiological response that the body is mounting against the stress becomes detrimental. It becomes overwhelmed, and then it becomes detrimental to the effort. So there is a subjective feeling of distress, that the person feels overwhelmed, anxious, may have stress reactions. And objectively also we can see that there is a change in their behavior, their performance goes down, their interest goes down, they start to burn out, they don't enjoy things anymore, they may go into withdrawal, or they might be irritated. So distress is basically when the stress is so severe that it overwhelms your coping ability.
So what are the stressful factors, especially in government hospitals, as well as different set in private corporate hospitals, as well as individual practitioners? So three different categories, what exactly they are facing in their practice life.
So to be honest, I've never worked in a government hospital, but I've had friends who have worked there. I think that the biggest stress in the government hospital is, number one, sheer workload. Sheer workload. If you look at the Institute of Mental Health here in Hyderabad at Eragadda, you will see 300, 400 patients thronging the OPD. It's a 3-hour, 4-hour OPD. And there will be 5, 6 doctors who have to look after that kind of. It's simply impossible. So the sheer amount of workload in government hospitals is a major reason for stress. The second thing is that we all know that our doctors are struggling with very, very meager resources. There will be very limited amount of medications available. We don't have enough beds. We don't have infrastructure. We don't have all the resources which we need to treat people. So I think that most of us believe that our doctors are among the best trained in the world. They have a lot of experience. They're very smart, very compassionate people in the field. But if it's like giving you an old Fiat Premier Padmini and you are told to drive on the Autobahn in Germany, it's kind of difficult to manage. You don't have the equipment to do it. So I think that lack of resources is another big problem in the government setup. And then it's bound to lead to low work satisfaction. When you're not able to cope with the things, you're not able to deliver the results, you're not able to do things as you want them to be done, it's a great difficulty. In the private practice, I think that a lot of that, as we discussed during the presentation also, is to determine with what kind of goals we have set ourselves and whether we have set goals or not. Most of us don't have a goal. It's a 9 to 9, 6 days a week kind of goal, which is not a healthy goal for ourselves. So I think that a lot of those things are built by us. Then I think Dr. Naveen pointed out from Dr. Vyasa's presentation, expectations from patients. We want to pay for a bicycle, but we want to ride in a Rolls Royce. That is the expectation that people have. Most of the 90% of our population pays nothing towards healthcare, nothing towards healthcare. But 100% of people want that. It's almost like you're at Johns Hopkins or something. So the expectations on people to deliver are enormous. And doctors are, I must say that we are the most innovative people around here in our country. The kind of innovations we do, the kind of things that we do, how we manage is extraordinary, but it places a lot of stress. So I think that there is a mix of factors which we cannot help: a low doctor to population ratio, bad infrastructure, lack of funds, lack of resources, along with that, high personal ambitions, workaholism, refusal to have compartmental lives, always seeking to have the greatest possible success in one field predominantly. Those things are responsible for stress in various setups.
So how to handle situations, Anurag sir?
I think that, if you ask me very simply, I would say have reasonable goals. Have reasonable goals. Have multiple sources of satisfaction in your life. Like I said, money, we discussed that money is important, but there was this very interesting study which has recently been challenged by some people that, okay, no, that is not really true. That study found out that in the US, if a person is making $75,000 a year, above that, if you are making more money, it doesn't really add to your happiness. There has been a recent challenge to that study in which some people have said, no, it does make a difference. But that was an important finding. It isn't that your happiness, satisfaction, contentment of life will, along with money, will follow a linear curve. It doesn't. It doesn't. After a certain, do you need a certain amount of money to solve it? Of course. But most doctors have that kind of money. After that, what happens is that the amount of effort that you're putting in, your money may be rising, but your satisfaction and all will plateau off. And at higher and higher amounts of effort, how much you are achieving and how happy you are don't match up. In fact, the more you achieve, the harder it gets to achieve more. Then the return on investment diminishes. So if you say that I want to be, at the top of my field, and you are among the top 10 of your field, and now you want to be the top, the amount of effort that you want to put in, and anyway, who determines who is at the top of their field? I never could understand that anyway. But the amount of effort that you will have to put in is just not enough. I would say to people, please have reasonable goals. Please give importance to other areas of life which are great sources of satisfaction. Human relationships are the single greatest source of satisfaction and contentment in life. Pay enough attention to your relationships.
Dr. Raj, welcome you. Just your take on this stress and how to cope up these stressful situations. What is your opinion on this situation?
Thank you for the opportunity, and apologies for not being there earlier with my presentation. And yeah, two very good presentations earlier. Thank you, Dr. Srivastava and Dr. Naveen. I would concur to what Dr. Srivastava was saying, but also what Naveen was saying was in terms of how do you understand it from multiple factors. So instead of asking me that question, I would say, why don't you ask that question to yourself? Because I might be very stressed because let's say the upma I was trying to cook this morning did not turn out right, and my wife will be very upset with me. Whereas someone else might be stressed out because their purchase for the Rolls Royce or whatever was not achieved, and they're only able to buy a Honda. Okay, so you need to ask that question, saying what is that is causing this stress, or what are the various factors that are causing or adding stress to me. And that's very, once you have a table of those things, I would say start addressing them. If you say, I can't address that big challenge, I can't address the boss who is really troubling me, I can't take his job off, but my other stressor is, let's say the boss related stress is 80%, Whereas something else, a little thing in terms of how do I get to work every day is causing 10% of stress. Address that small one and you have reduced your stress level by 10%, right? So we are all clever people. What we don't do, as Naveen was saying earlier, is we don't problem solve. We think that's a fixed amount of problem. And we try to do, interestingly, we try to do more work or more of the same to solve it. Effectively, you add more. Okay. So stop. I think that's what I would say. Stop, look at it, analyze the reasons for the stress, and you will have your own solutions. And if you come to me, I will say the same. I wouldn't say this is how you should reduce stress. I should say, what are the things that you are finding stressful? Let us pick the list of it, and then we will ask you to pick the one that you can address the state most.
Next question. So, how to involve the organizations and their managements to reduce their employee stress? Any some strategies? Dr. Anurag, sir?
So I have given a fair amount of talk on stress in various companies, including Google. So some of them are not, everything is not as it appears to be, even in Google, I will say that. But one of the things is that, if an organization gives importance to the mental health of physical and mental health of its employees, not just to the bottom line, then a lot of things can be done. What corporates need to understand is, if you pay attention to the mental health of your employees, your bottom line will improve also. Your profitability will improve also. So you see, reasonable work hours, maximum support possible. So there are, Scandinavian countries are offering 18 months of maternity cum paternity leave. You can choose paid leave. When I remember when our first daughter was born, my wife was doing her DNB in surgical gastroenterology here in Hyderabad, and she was given 90 days maternity leave. She was recalled at 70 days saying that you just have to come back. That's it. If you want to keep your registration in the program. And it is now 18 years since that. My daughter will turn 18 on 10th of May. And we still are waiting for that paycheck. We never got paid. You see, it's not about the money. It's about the support that the organization has to give. Plus, when people are in distress, you should have a program which helps them. Some of these big corporates also, which do have a program which helps them, have a very limited program. I've had people come to me from Google, where Google is paying for their therapy, but they paid for 4 sessions. That's it, gone. On the other hand, during this pandemic, Google gave $1,000 to every employee to set up a workstation. See, the amount of support which is required from the companies has to be much higher. Working hours have to be reasonable. There are so many countries in Europe. Germany has started that experiment, whether a 4-day week is as effective or more effective than a 5-day week. They've started giving that experiment Wednesday off. And they found that productivity has either increased or remained the same. It has not gone down. So I think that the amount of support that corporates or corporations can give their employees, it is non-existent in most of our companies.
Dr. Vyasa, next question to you. So, how to overcome this internet or mobile or video game addictions? Now it is a social evil, disturbing personal life as well as professional life. So, your opinion on this?
You have actually opened a Pandora's box. It's a big topic on itself. I don't mind coming back and talking to you in length about it. But the key is in the word addiction. Okay, when we think about addiction, let's all remember our basic neuroanatomy readings from our first year. There is an addiction pathway, a limbic system which is active, which is not being rewarded effectively in a normal way. Okay, so the person is trying to massage the limbic system by using various substances. That's the whole hypothesis of addiction. Okay, in a gaming addiction, in a social media addiction, that's exactly what they are getting. They are getting a rush when their post, their TikTok video, their Facebook picture is liked, shared. They're getting a clap. Okay, so you are chasing. This is no different to an alcohol or an opiate addict chasing the drugs. So these are called behavioral addictions. These are no different in a internal sense, in a working sense, to a substance addiction. Why are they happening? I think the question I would say is, why is it happening in the first place? In the first place, it's happening because they don't have normal simple pleasures that they have probably they're missing on. Let's say what Anurag was talking about earlier in terms of that relationship, that interactive time with friends and family, sitting and having a meal together. These all give pleasures. These all give nice, nice release of hormones that make a person happy. Probably we are missing in our busy life to get pleasure from these. So we are chasing that through your internet and your phones.
Next big question and theme of today's panel discussion, the COVID-19 impact on mental health. So just yesterday, one young doctor got suicide done, and one more colleague recently texted in the morning with video losing so many of patients, very young patients, and with available resources. So probably we are not able to treat them, and we are in a position to choose which patient to we put on ventilator, which patient to remove the ventilator. That kind of situation has already arrived in India. So what is the this psychosocial impact of this COVID-19 pandemic in the current situation? To all the panelists, first I'll go with Dr. Anurag sir.
The situation is overwhelming. See, as a psychiatrist, I am personally not in that position because I don't know how to take care of people who are suffering from COVID illness, and I'm not in the front line. But many of our friends are, and we see reports every day, and we talk to our friends. A lot of friends talk to us, and I mean, here no person who has got, no matter what your resources are, what your ego strength is, how much resilience you have, there is no person who can be untouched by this situation. It is a catastrophe of unimaginable limits here. So I feel that in this kind of situation, it is impossible for us to feel that we will not be affected. We are going to be affected. There is no doubt about that. To what extent we are affected? As I said, your genes will determine it, your temperament will determine it, your coping mechanisms will determine, most of which are not conscious. We are not consciously controlling these things. None of these things we can control. I think that the greatest sense, what I feel talking to my friends and listening to people, is this sense of helplessness. Helplessness. See, if you have got, say, a patient who has got pancreatic cancer, and he comes up, you know what's going to happen. You know what you can do and what you cannot do. I think that in this illness, first of all, in the first wave, we didn't know really what to do. Slowly, we have gained competence. Now the doctors know what to do. They can save the vast majority of people. There will be some deaths, but now things beyond our control, beyond the doctor's control, are operative. So that self of helplessness is the single most important factor here. That feeling, if you look at our diagnostic criteria for depression, helplessness, hopelessness, and excessive and inappropriate guilt are strong markers of suicidal ideation. We are always taught that, okay, look for hopelessness in people, look for helplessness and excessive guilt, because they are strong markers for suicide attempts in the future. And I think that hopelessness and helplessness and that guilt, this situation has caused this criteria number 8 in the DSM to become the biggest problem in our lives. And that is why I think that is going to happen. What can we do? First of all, as I said, I think none of us are untouched by it. People like me who are not in the front line, there is a constant sense of anxiety and worry. It's very difficult to be at peace. There is no peace. You know, you're struggling. What can we do? We can follow science. Science. That is the only, I would say that science gives hope. Follow the protocols in your treatment. Do the protocols for your own safety. And know the limits and limitations of doctors, and not doctors so much here. The limitations are of the health system here, the infrastructure. Know those limitations and slowly be more accepting of it. It's easy for me to say. I know it is very, very difficult to do. You know, I'm sitting here as a psychiatrist who doesn't deal with COVID patients like that and talk. It is very cheap for me to say these things. But to help my friends, my colleagues, young doctors, I would say, follow science. Use the protocols for your treatment. Use the best protocols for yourself. Be content with what you're doing, because what you're doing is a marvelous job. Nobody has done this kind of job ever in their lives. And be more accepting of some of the things which are beyond our control and which we cannot help. It is very inadequate. I am very aware that what I'm saying is very inadequate. But we are also overwhelmed that we have to do the best we can. That is all.
So, Dr. Naveen, your opinion on the current situation?
Yeah, obviously, Raghu, what I'm telling is this COVID-19 impact is because I am working in the AIG hospital itself. It's a designated and the services are giving for the COVID patients very enormously. Currently, the 400 bed for the COVID patients are there in our hospital. So I have having of multiple chances with our colleague doctors. They are sharing their level of the impact of these COVID services and their what is the toll on their psychological health also there. Usually the number of people that they're unable to get the relax, unable to get the family members to freely having of their fun time. These are the common concerns they are expressing. The one thing is I'm telling you what you said that's a 2 deaths in recently by our doctors. So here the still pathetic thing is we are all aware about this not okay personal factors, definitely it's a genetical and as well as psychiatric morbidities and some vulnerable signs of warning signs which they are exhibiting before committing suicide, about their suicidal communication, what they are telling that. So we have to at least a peer interventions, suppose for example the institutional or systemic interventions we need to involve to prevent this type of the our colleague deaths or calamities. The second thing is very important thing is we one thing is the attitude about the professions we needed to change also. We are not become scapegoat of this pandemic, because especially the people who are having of what is it, the protocols are very dynamically changing with the situation to situation and strain to strain and pandemic wave to wave. Okay, and even within the region, within the institute, there's so many variable protocols are following. Even within the multiple departments having of multiple protocols also they are having of their own opinions. In this, definitely in this type of the tussles, we definitely a sort of the tensions will be generated. But some people are getting to involved to succumb this type of the catastrophes. So what I'm telling is the persons even in our curriculum and in our attitude, we needed to amend, give the need to important of this mental health importance also. So at least the very essential and serious topic like suicides, very worthy to discuss and worthy to having of to aware about what the type of the referral system we have to follow, even for the self treatment also. So if you establish in the systemic wise, even personal wise, then I think so we have to prevent these things also can possible. And very importantly, very institutional level also hotline helplines, not only for the patients, Even we have to give the option for the health providers also. We have to give there to express their feelings and have to give enough time to talk the facts, enough time to talk the what type of the experiences they are having of these things. Just give some time and to relieve their ventilate about their emotions and feelings and sorrows what they have, and we have to accept what the reactions they have to show. So then beautifully we have to give some review on their experiences. Then this will be the setup of the services, make them to provide some growing of their skills to how to handle these type of the situations. Obviously when we have the markers of the depressions, markers of the suicides, like what Dr. Anurag sir told, that helplessness and unworthiness of ideas or hopelessness ideas there, we have to don't hesitate to give a valid, effective sage evidence-based medicines and as well as therapies also for the patients. So, and very importantly, we have to involve their families and supports, how best they have to give the support for the health providers also. So with this is the, I feel it's this type of the responses you need to do as well as. Thank you, Raghu.
Dr. Vyasa sir, as doctors, we are trained to save lives. Now we are in a situation to choose the life, which life to be saved. It is a horrible situation. So from my colleagues also, just I got other questions. So while dealing with these COVID patients, is there is chance of reinfection? That fear is there in our minds. And after recovering from this COVID infection, there is a post-traumatic this infective state. So how to go back to the work? These are the questions among our colleagues. So how to address this from UK point of view as well as Indian scenario?
First of all, deep condolences for the young doctors who have taken the extreme step. I think we as professionals will need to stand in solidarity with them, certainly. The question directly, I think it's a very difficult answer. What we are actually witnessing is a very evolving situation. If you want a surgical answer, go to a surgeon and they'll say, let the pathology complete and then I'll do a surgery to remove it. Right now, the trauma, the big pandemic is still unfolding, and we are already asking for answers of how do we deal with the aftermath. I think more importantly, as hope was being mentioned earlier, we can generate hope by actually making an action today. Is there a hope of us influencing the pandemic now? Instead of being just washed away with the waves of pandemic, can we actually do something about it? And as Anurag was saying, science is the savior. I would extrapolate and be a bit more political here, and I would say truth is the savior. And we don't have people who are standing up from the scientific fraternity, the epidemiologists, doctors, and others, and taking a hit against the people who are not believing in science and truth. So if we did that, we would have a chance to give for the pandemic to not progress in the same way. Maybe we can use scientific methods of workforce planning, scientific methods of restrictions, scientific methods of allocating resources where they are needed, scientific protocols for admissions and treatments in the community. Science is something that we are trained in, but we don't advocate it for it standing on the podium. We sometimes get washed away for various pressures. I would say maybe we need to take a leaf from Fauci, who was pushed off from being the advisor to Donald Trump. But he prevailed because he stuck to the truth, he stuck to the science, and he didn't change. I would say, yeah, a more political answer, but maybe we need to actually put our viewpoint, i.e. the medical fraternity viewpoint, loud and clear, so that we can at least stop or limit the extent of the pandemic.
So how to cope up with the psychological stress of getting infection as well as this post-infection stress, and to avoid go again to the same patients, treating the same patients?
I think, first of all, let's accept this. We are being hurt. Whenever we are hurt, we will have a bit of a time that we need for recovery. Okay? Let's agree agree to that. And when we are hurt and we got an infection which has a lot of comorbidities, including fatigue and tiredness and weakness, we have to give ourselves the time to recover. We have to give ourselves a chance to say, I can't go back to what I was doing. I will have to limit my time of how much I can work and who I can help. Obviously, as it is a big wash of patients now, there are many people who will need help. But I think we'll have to limit to what you can do in each individual's practice, so that you can do that for longer rather than you be taken down once again, right? So I'll give you an example. A house is on fire, okay? Do you think the fireman will jump in and try to save everything, or will he stick to his protocol? Will he put his suit on? Will he get the water hose? And will he do the most systematic approach to douse the fire? The house might be burnt, but his target will be to save what he can, right? I think we need to have that limit. If we jump in, we will end up like the famous Abhimanyu, because you went in without a strategy of how do you come out, okay? So you need to be thinking through, and when you come back after an infection or after you got overwhelmed, you need to say how much you can do. There is always more than what you can offer that is needed, but I think you have to put your own limits.
Next question to all the panel members, sir. This is also a very important topic. So depression effect. So how to identify our colleagues or our medical students who are in depression? So how to help those people who are in depression or having a tendencies towards depression? So I'll come with Dr. Naveen.
Hi. Yeah, Raghu. So this is a depression is a what we know that it's a psychologically a feeling of a low mood or something, a type of the anxiety mood also. Okay. So we have to observe with our colleagues what type of the mood change we have, whether he is expressing and as well as communicating through in terms of the verbal and some of the non-verbal things also. For example, they have to have talk that I feel low, I feel a lack of interest to do the participate in the social things. So these are all the markers for him to say that what type of the mode is carrying out. And sometimes the people are showing that they commit some concentration difficulty things, like suppose errors they are frequently made in the records and having of the errors to compiling in the what's called paperwork something. And some people in routinely we observe that they are communicating with the somatic forms in terms of the having of sleep, appetite, energy, and sexual disturbances in form of that. Suppose, for example, they used to wake up in early times. So some people are having a feel that the low lack of appetite or increasing crave for the some favorite foods only as a coping methods. So these type of the signs we have to observe that. So sometimes the people are feeling that they're having a lack of energy and easy fatigability also. Suppose, for example, they used to get to lose their thread of the concentration while doing the cognitive work or something. They will get the more pains in terms of the stress, headaches, and some people they're complaining that low backache easily. So these are all the markers we have to note it that, and these are the symptoms wise. Whereas the coming to the situation understanding wise also, we have to understand the person, whether the person is relentlessly they are doing the work, excessive work, not only work, lesser hours of work is not a only marker. Sometimes the people used to cope with doing the excess work also. So, but at the same time, the productivity of the work is becoming quality is becoming lessened. So these are all the things are having of marker for his mood also. So with this, we can able to pick up some, and some people they communicate their mood through forms of the thoughts level. So for example, they express their helplessness, and frequently they express their unworthiness to work here. And some people they frequently wanted to change the jobs. So these are the markers for that. Some people they express directly hopelessness regarding their they feel that like a entrapped feeling they used to having that. So these are things are we have to keep the patient there. We have to refer certain psychiatrical health and department people. We thoroughly assess with the clinical and as well as some assessment wise also, physical and as well as psychological assessment. Then if the person is really suffering with the depression, we need to educate them to take the professional help also.
So I think Dr. Naveen has pointed out most of those things. I think that the most important thing is for us to have the time to listen to people. We must have time to listen to them. Some people come up with some early signs of distress. We sometimes we may feel that okay, it's not severe enough. We can work on it better, things like that, and we let it go. But I think that if we spend more time and we give them the time to talk, I think we'll pick up a lot more things. And Dr. Naveen has given a very good list of how we should screen. So there's nothing for me to add there. But see, there are only two luxuries of life, I always say: time and space. Time and space. It is always good. We can always be crunched for time. But the thing is that if we want to pick up more people who are depressed, we have to give them a platform where they feel that they are being listened to, not being judged, and not being given quick superficial advice. These three things, if we do, if we listen to our friends and our colleagues, and they feel comfortable talking to us, and we don't tell everybody the same thing, that improve your diet, exercise a little bit, and listen, do some yoga and listen to music, and we have this ready-made template, and we give this to everybody, then it's not personalized enough. In when I was in internship, so in those days, scabies was very common dermatological condition. I don't know how it is now, but we used to have every other patient is coming with scabies. So we had a rubber stamp with the whole instructions, a huge rubber stamp, this big. So all the instructions are written in that you have to wash all your clothes, you have to put this Tetmosol soap and whatever the ointments. So you just stamp it and give everybody. See, in mental health, it won't work like that. One size fits all doesn't work. So time and a patient here, along with all the wonderful screening things that Dr. Naveen has said, that is what I feel is important.
So Dr. Vyasa, sir, focusing on medical students especially.
I would say, the organization you are supporting right now can actually think of an initiative. I'll give an example from UK. I support what we call as doctors in difficulty schemes. So these are experienced general family physicians or psychiatrists and any other professionals who are willing to give that time back to younger people who are either upcoming in their career or ended up in difficulties. Everyone, it is human life. We are all going to have things that are going to stress us out. It is nothing against your clinical skills or aptitude or abilities. It is what is being thrown at you. People can get into difficulty. If we are able to support those people in those difficult times, then you would have given them that opportunity to survive that, learn from the experienced colleagues, and come back with greater vigor and support. As I said, in UK, the MCI or IMA equivalent has a doctors in difficulty scheme, that is a GMC. Everyone who's been referred to GMC is looked under the eyes of, is he in trouble? A doctor who's seeming to be difficult is a doctor in difficulty. Let us see how we can understand it, how we can support them. Okay, before you judge them, you are seeing what is that we can give them to make things better for them. Okay, so that could be the psychiatrist, that could be the counselors, that could be experienced tutors coming on roll and saying, hey, if you are struggling with this, why don't you take this kind of work rather than that? Yes, some people might have come into the profession by force of parents, which is quite common in India, and they might not want to be in it. Maybe that will give them a second chance to say, you came in, you are a good student, but maybe you want to reconsider your professional career life going forward. So nothing wrong with it, nothing shameful about it. So let's look at what are the next options available for you, which will probably be more enjoyable for you. Okay, we have actors who used to be doctors in the past now. Okay, but they're doing successful career now. It's not a shame because you left it. You're not a failure. but that message needs to come from peers. That message needs to come from people who are seen as working within the profession. It's not as Anurag said, one stamp that we need to give it to everyone.
Next question, Dr. Naveen already pointed out in his lecture, physicians burnout and how to manage this situation. Briefly, I would like to hear from all the experts in a practical way. Dr. Anurag, sir.
Work well within your limits, not to the extreme edge of your limit or beyond your limit. Your life, you should have a life outside your work life, a life which really matters to you, which you enjoy, which like, for example, this pandemic has been so stressful for all the people. Yesterday, my daughters and my wife and I, all of us were having a discussion. And both my daughters said actually that I'm horrified by what is going on, obviously, by the deaths in the country. But the lockdown, I will miss it. Because we had so much time at home. We spent a lot more time with each other. They said that their parents' cooking skills are much better now. And we had so much time with the family and do things which we never had time to do. One of my friends posted a picture of him sitting in his garden in Kerala. We are school friends. And he said that for the first time in 20 years, maybe he has added a little bit of garam masala to it, but he said for the first time in 20 years, I'm sitting in my garden and enjoying my garden. You see, for a lot of us, we don't enjoy what we have. I think it's very, very important to be grateful for what we have, to enjoy what we have, to be able to look at those things around us which we never pay attention to. I think it's very important. There's this very nice movie, I think it is called About Time. It's not In Time, it's About Time, in which these gentlemen in this family have the ability that if they clench their fists and they close their eyes, they can go back in time in their lives to whichever point they want to go. And then they can change things, like one of them, his sister actually has a drunk driving accident. So he goes back in time and he stops her just as she's getting to go in her car and said, I will drive you. And he prevents that accident, things like that. And the real meaning in that movie is we can't go back in time. What is the meaning of that movie? That movie suggests that you live your life as if you have had the opportunity to come back in time and live it. You would probably live it a little different. Small things. So in one of the scenes, they're running through one of those stations in England, Charing Cross, or I don't know which one it was, but a beautiful architectural piece. And he's running. He's a lawyer in the movie. He's running. His assistant is also running. They're madly trying to catch a train. And then he stops in the middle and he looks around and he says, what a marvelous building this station is. And his assistant has run past him. Then he stops and he looks and he's looking at him. That, are you crazy? What are you doing? So he just stops for a minute to enjoy that and he starts running again. So they have made it funny. But the thing is that many times in life, I think we are not paying attention to what we have. Gratitude as a great component of well-being, of satisfaction, of contentment. Real gratification, not just the lip service that, oh yeah, I'm very thankful for what I have. We all say those things, but that is not what we feel. I think that if you feel that gratitude, that I think is an important thing in our lives.
Dr. Vyasa.
I would like to propose a very practical thing. An institutional kind of a thing. I would like to propose saying people who are well-meaning like this should form a mentorship or a supportive part, which would be a charitable work. It's unpaid supportive work for younger people or people who are at risk of burning out. Because when your colleagues are saying you're running too fast, you're going to fall down, you're likely to listen. It is not uncommon. Every industry has mentors. Every industry has mentorship programs. I mean, big multinational conglomerates have, like the airport owner in Hyderabad, GMR, he has a mentor. He comes from a different industry. Sit for a period of time and reflect on how your work is taking you, how your life is treating you. Exactly like what Anurag was saying, being mindful, mindfulness-based work and reflective way of working and supporting colleagues to do that more is very useful.
Thank you, sir, for your valuable suggestion. Probably from our HRDA, we'll think about it. So probably having a group of people and experts from the psychiatry field and psychoanalysts will group together to help our colleagues in future. We'll come up with proper planning. So with the help of all your team. Next, I'll move on to the next. Dr. Bharat, you can ask the question now. He's asking one audience and he's a member of HRDA.
Hello, sir. It was a wonderful talk by Dr. Anurag and the whole team, the whole organizing team, and it was fantastic. I am a practicing radiologist. I am a civil assistant surgeon. I'm in the government service also. I like to bring 2 points, and it's not a question or it is not something. I think every member or every senior faculty should also think in this lines. This is only my proposal. It's not this one. What I think about the whole thing. Okay. Most the scientific temper in the doctors' population is to an extent reducing. They should. I personally feel that science is the one which is keeping us at the top. Okay. This profession is because of the scientific temper and science behind the whole stuff of so many years of research. Okay, that seems to be reducing, sir. Number 2, pandemic can only be treated by policy and science, and there is no second word for that, because policy cannot be treated by only medical people alone. That is the bottom line. But we should enhance ourselves into that policy. Every hospital, every small medical center, every oxygen center also should have a protocol. Every corporate should have its own protocol for mild, moderate, severe, all this type of management. Unless it is done, there will be a huge burden on the mental health of healthcare professionals who are getting involved. Leave alone radiologists who are reporting a lot of CAT scans now, 200, 300. It is going to be a huge burden if there is some wave like this again, second, third wave, fourth wave, all in that light. Number 3, sir, please make regulatory bodies strong. Unless we don't make regulatory bodies strong, it is going to impact our health. Okay. Fourth thing I want to bring to your everyone's notice is, I think this happened even before pandemic. Okay, make job guarantee things for people, because unless we don't do job guarantee.
Can I interrupt you here?
Sorry, sir. Yeah.
Yeah, the current topic and discussion is completely deviating towards administrative side. Probably we can have one more webinar on those things and we can bring all those issues. So currently we'll stick to our program, and now I'll go ahead with the next question.
Sure. Thank you very much for the opportunity.
The next question. So when to seek medical help for suicidal behavior amongst doctors? So Dr. Naveen?
Yeah, Raghu. So this is again the subjectively every doctor, every person have to take some with the awareness. They have to take some responsibility about their psychological health also. They have to see health is also encompasses with the mental health also, and as well as well-being. So here, whenever the person he feel that he is having of a new type of the experiences with the recent challenges or from the cumulative challenges, he is experiencing of any type of the entrapment, feeling of loneliness, a feeling of overburden or emotional exhaustion, whether they experience or whether they're having of the continuous pervasive, a type of the lower anxiety mood he is experiencing, something he's an indecisiveness in their work, routine work also he is experiencing, or he feeling that more and more errors are making because of the concentration difficulties he is experiencing. Sometimes they have the feeling of a type of the hopelessness when I come to see as in routine to get the normal life with this pandemic, which make them to the feel of entrapment or something, feel of the isolation, which make them to all the things are is a worthy to give space and time. What the Dr. Vyas and Dr. Srivastava told that a personal a type of attitudinal change in terms of the giving your career as a not only to the compassion something, even personal compassion also should require towards the life. Okay, then personal contribution from that side. What the Dr. Vyas has told that the systemic interventions wise also institutional policies which make them to the intervene to get to seek the help as early as possible. And with this, all these things, we have to get the person who is in needy thoroughly to get to assess, and followed by the we have to get to treatment. What type of the services, individualized services, whether he or she require. Sometimes the especially the female required services are different compared to when the other our doctor colleague, male colleague also. So for example, these type of the gender specific services also we need to continue in the even not only personal aspects, even the systemically also need to change through the policies only. And last but not least, comprehensively to if you need to point out something, we need to even the social trend which we have. So you see up to so far what the trend we have seen that. So n number of the patients also when they created, they have to become the burden on the health system. So we have to see the innovatively from the policy leaders also. Innovatively, they have to think to utilize the what are the existing health system they have, what are their limitations, and how innovatively they have to utilize the resources. Like suppose for example, the vaccination centers also they need to utilize the schools buildings also. So these type of the innovative things also we need to consider in the even the health system also. Like suppose public health interventions, for example, the clear policy related the protocols we have to create. So these are all the make them to the lesser the depression and increase the referral system to the for our colleague within the institute or within the region or within the country. So and very importantly, hotline services make them to the easy access and easy affordable to get the to access these type of the services. For example, a brief talk in terms of the debriefing also helpful for the stress reduction from the person who is in needy. So these type of the services also we need to consider. Thank you, Raghu.
Dr. Vyas, sir, next question. So it's very difficult to convince the patient or as well as a professional colleague to say something is having some of the psychological issues and to direct him towards a professional colleague. But unfortunately, they are reluctant to accept their current situation and they're not moving towards professional help. So how to tackle this situation, how to convince them? Even I see many patients who are having some psychosexual issues, and when I'm talking just take help of the psychiatrist before coming to me, then they're reluctant. So how to address this issue?
I think we are hitting at the bottom of this, that is stigma. Yes. There is huge stigma that is attached to psychiatry and psychiatric patients and psychiatric issues. I think that's not just within society, amongst doctors too, in spite of being in the medical profession and understanding that mind is an organ and mind can also fall sick and it does need its own treatments. We struggle, or we haven't been wise enough to understand that we can also identify that and get them the support. Okay, so yes, so as Naveen was saying, institutionally we need to have these open dialogues of saying, hey, how are you doing? I mean, if you see a junior running, I don't know if most people would have seen this movie, The Beautiful Mind, where Russell Crowe plays the very highly intelligent professor or something like that. Okay, and at some point, a very young internee comes up and she's so proud to show the equations she solved. The first thing he says is, "When did you last eat?" Okay, instead of saying, yes, yes, you're doing very well, do more work, he's actually become the human there and said, I burnt myself by running like this. Don't do the same. So have a break, have something to eat, and we can talk about work a bit later. So I think if you are seeing younger colleagues doing that running, maybe you can say, yeah, why don't you take a break? Let's go out for a coffee and have a chat and see why you are running. Why are you not stopping and appreciating what's around you? Okay, and let's encourage that amongst colleagues.
Okay, so next question to Anurag sir. Vulnerability recognition is important in burnout, depression, and suicide. So, how to identify and overcome in a practical way, just to guide our colleagues towards professional help?
There
Vulnerability.
are, yeah. So that's a very deep question actually. Probably I cannot do justice to it, but I will highlight some of the things. Number one is I think that I've been saying this for some time. A lot of vulnerability is genetically determined, temperamentally executed. There is no weak or strong people like that. Everybody has different. Some people can be very, very resilient in one situation, but very anxious in another. I think that the telltale signs of vulnerability are the early markers which we read of in depression and anxiety and some of the stress related conditions. So subjective feelings of being overwhelmed, a dip in the interest, what Dr. Naveen had pointed out, so many of those points, and a change in the ability to work and cope. The important thing is that we have to create an environment where people can come forward and report these subjective changes. The subjective changes predate objective changes by a large margin. I give the example of using blood sugar for diabetes diagnosis or urine sugar. By the time other people can notice that things are happening, things are already have deteriorated a lot. Subjective experience is the most important marker here, and it's a great challenge to be able to create an atmosphere where people feel comfortable talking about how they are feeling. And I think that that is one of the great challenges in identifying vulnerable people. Now, there are some hard data which are there for identifying vulnerable people. So, for example, past history of depressions or anxieties, past in stressful situations or otherwise, family histories are very important. To be able to have that kind of data on file is important, but that data cannot be accessed. It's a confidential data, but it can help us when we see something going on or help people when they come to talk. And then there are many other conditions. For example, single people, poor social support, substance abuse, history of changes in the behavior or decompensation during stress, recent stressors which are going on, changes in job, loss of family members, sick family members. All of those things cumulatively help us to determine people who are at risk for these things. But we will not come to know all of these things unless the person feels comfortable enough to report his subjective experience. So we should focus on making that an important thing. So, for example, in our medical college, we have a hotline which is manned at 24/7 by us, in which people can call anonymously if they wish, uh, absolutely 100% confidentially, and it's a free of cost 24-hour suicide hotline that we offer. We hope that people will feel confident enough to be able to use it more and more if they need it. But it is a challenge to create that atmosphere where people feel comfortable talking about their subjective experience.
Dr. Vyasa, sir, is there any anti-suicidal medicine? Any updates, sir?
I I would, considering the audience is very wide, I wouldn't jump to a medication called anti-suicide medication. I would stick to the interventions we have been talking about rather than jump to medical therapy without actually understanding the problem.
I'll move to the next question, as already answered. Stressful COVID duties, managing patients simultaneously, answering multiple phone calls of their attenders. How to handle this situation? Dr. Naveen?
Yeah, Raghu, see, multitasking, simultaneously multi-demanding tasks should need to perform in these times, COVID times especially. So here again, what's the Dr. Anurag sir and Vyasa sir has told, that the strict protocols we have to give some easiness in their execution of their work. Okay, so at least a sort of the professional communication can be possible with the protocols. Otherwise, the subjective bias which make them to again to get to into tussles. And second thing is we have to what Dr. Anurag sir has told in the earlier times, the limitations of the work, how much the best we have to do in the work times, with the available of the working stretch and as well as intermittent breaks are very much important. And intermittent relaxation activities also very much important to boost their concentration abilities. So by that way, we have to intervene the some concentration errors also we have to intervene with the having of a good adequate breaks at a stretch of every around the 1.5 hour. Every 1.5 hour we have to take a break of about 10 to 15 minutes. Is if it is having of some physical activities, and then it's again fine. And sometimes the end of the day, whatever of the accomplishment we have to having with the work and having with the family, and what is the personal satisfaction which we are getting. So we have to keep to monitor about ourselves. If whenever it is a threat is happening to our personal self-esteem, self-efficacy, and as well as accomplishment feelings when they happen, don't hesitate to take the help from the seniors, experienced peoples, and because they are already with their wisdom, they have to see that what type of to work we have to do in these type of the difficult times. Because this is the what I'm telling you, in the earlier Vyasa sir has given certain slides. It's a beautifully depicting that. Have you feeling of this type of burnt experience phenomena only in this COVID time or prior to COVID time? It's a beautifully majority people have responded. Prior to COVID also we are having of this type of the burnt out. So what we learn from the experience, so how the way we have to execute with our whatever the multitasking we have, with the help of the seniors, with the help of the professional guidance, and whenever they require mental health people, mental health requirements are there, we have to take with the consultations from the psychiatry people and their teams. And by that way, we have to not only personal health, we have to increase, even the productivity of the institute also get increased. And at the same time, at the society also, the demand and something pressure on the health system will be get reduced with your individual work also. Even one individual work also absence. Suppose, for example, one individual COVID duty is also person also getting absent. That will be become burden to another person in these times. So that's what I am telling. We have to protect each other and every person with the intelligent and feasible plans. Thank you, Doctor.
Next question, Dr. Anurag sir. Question from undergraduate. How can we be strong mentally without reacting to unnecessary thoughts?
I don't believe that you're strong or weak mentally like that. I think that unnecessary thoughts come to all of us. There is nobody who doesn't have unnecessary thoughts. In fact, I would go so far as to say most of my thoughts are quite unnecessary only. I have very small lucid intervals in which I have some reasonable thought or some constructive thoughts. So we are all going to have some useless thoughts. We should be accepting of some useless thoughts also. I think that the most important thing is to have clarity about purpose. Which way you are, what you are doing, do what you love to do. You are on a journey towards doing something which you like. Enjoy the journey, not the end destination. End destination will come very far away. It will last for some time. The train will stop at that station for a few minutes and leave again. New destinations will come. Oh, I want to, first what we think, I should get into medical college. That's all I want. After that, I should pass all my MBBS. That's all I want. I should get into MD. That is all I want. I should get into DM. That is all I want. I should get into good practice. That is all I want. I should have good name. That is all I want. I should have enough money. That is all I want. I want to be head of department. That is all I want. Want to write a book. That is all I want to want. I want the whole world to know me. That is all I want. It's never ending. It is never ending. I would strongly suggest that enjoy the journey. The journey is the most beautiful part of medicine. Do not have unreasonable goals. Set yourself reasonable goals. Put in your best effort. Be happy with what your best effort brings you. That fellow got more marks than me. How does it matter? I'll ask all of my friends here. Do you care what your MBBS batchmate, what marks they got in anatomy or biochemistry? I don't even remember what marks I got, whether I passed the subject. I must have passed, but I don't remember. It doesn't matter. It's your journey. Follow a path. That this is something which I want to do. The happiness comes from following that path, being that person who wants to walk that path. And be content with your best effort. If your best effort produces this, that is more than enough. Don't worry about other people. They may be more talented than you. They may be more hardworking than you. They may have more resources than you. They may be smarter than you. They may be luckier than you. They may have a father who is a professor and head of department in the college. It doesn't matter. Their journey is not going to affect your journey. One train which is running on this track is not affected by another train which is going faster or slower or in the opposite direction. This is your life. This is your journey. Enjoy that journey. Be reasonable in your goals. I think that medicine is a wonderful profession. It's a beautiful profession. It's a very enjoyable profession. It can be horrible in these COVID times, but they won't last forever. And in general, medicine is a hugely satisfying profession. Just enjoy the journey. Don't worry too much about other people or other things.
The next question was, sir, how to get interest while studying without any distractions, from medical student?
Basically, I would say rephrase that word, unnecessary thoughts to
Yes.
creative thoughts. Our mind is a very creative space. It wants to create things. It wants to create beautiful scenarios, nice memories for itself. And so these are sounding like distractions. Okay? It's a language you couch it in. And then you say, if you're giving that opportunity for it, the creative element, then that part of your mind is also satisfied. I mean, play like a child, or paint, or dance, or do other things, not just study. Then you would say, yes, the creative element is fulfilled, but after that fulfilling is happening. I mean, let's think about what we eat. I mean, we'll eat out of a thali, isn't it? We just want to eat one curd rice all day, isn't it? So you can't have just academic achievement, excellence all your life. You'll need other aspects too. You'll need to be a more holistic being. So if you are getting other thoughts, welcome them. They are creative. Don't say they're distraction. But set your priorities. How much time can you give for your creative things, and how much time you have for your academic excellence?
Question from medical students, sir: how to overcome stress, anxiety, depression during exams, and how to study without any distraction? Dr. Anurag, sir?
I think I will go with Dr. Vyasa's recommendation on that. I don't really know. I was never that kind of fellow who could read so well or without distraction or anything. I too used to get distracted quite a lot. It's sometimes very hard to hold concentration in some of the subjects. They're really hard. Some of these subjects can be tough. Pace yourself. Stay in your limits. Sleep well. Have other activities. Set yourself targets. So one of the things which I employ is that I will have a broad target. So I have, for example, I have Davidson to read. I have 4 months to read Davidson. Davidson has 1400 pages. I have to read in, say, 120 days, 1400 pages. So that is, I have to read 10 pages a day to read it once. Break it down into smaller goals. Make it from the larger goal to a smaller goal. Keep it reasonable. Don't make it that 24/7 I have to study, 24/7 I have to be productive, I have to do this. Don't do that. Have reasonable goals. If you feel that, okay, I can't read all of Davidson, it's all right. You read what you can. You read some smaller books will be there, which you can read for the exam. Have good friendships. They will help you in the exam. You can ask the fellow in front of you, boss, what is this question, man? Leave it. Tilt your paper a little bit. Tilting paper is the most important preparation in medical science, because that is how you look over the shoulder and say, thank you. And write it down. Be reasonable. That is probably, some things will be hard. It's difficult to be. Don't be so focused on doing everything perfectly. Making mistakes is important. Allowing yourself to make mistakes is important. Be kind to yourself. Don't have harsh standards. This may help you.
Yeah. Next question. So, what is the impact of online consultation on doctor stress, Dr. Vyas?
Yes, I can definitely answer that. Online consultation, while it makes it easy for the patient to attain a consultation, it adds more work sometimes. You need to end up recording it or writing it up and creating a plan and ensuring that it is taken place from a distance. So it might be more stressful and it might cause its own complications, including, I know, court judgments and other things that have said, these are not valid. We will put you behind the prison if you prescribe and there is a reaction to that. Okay. So I would say, let's say that's the reality of life, but we need to once again have a proportion of how much online consultation you are ready to do. You can't just be there in front of the computer without any breaks doing online consultations. You have to mix it up with face-to-face people consultations too. And when there is unrealistic expectation of somebody getting all the help online, when they probably will need to come into hospital to get things done, set it right and say, yeah, you can only get initial advice. For further consultation and further work, you'll make.
The last question. So, stressful colleagues, what is the best way to address this without damaging the relationships? The question to all of you, sir. Dr. Naveen?
Yeah, Raghu, stressful situations, how it affects the relationship. I'm right? I'm hearing right?
Yeah, no. The colleague's behavior causing stress to you.
Okay. Yeah, it's again the very individualistic adaptation. So the individualistic, the way of the meaning to their relationship they are giving, first of all. That is the biggestly comes to what type of the skills we have to see in this that the interaction. Okay, so what I'm telling is, some, for example, a type of the miscommunication or bullying attitude from the colleague, which make them to the some upset or something which may generate the anger, some may generate the stress also. So here, what is the source of that stress? First, we have to ask for yourself innerly. We have to ask that what is the source of the stress. Whether the content of the communication making to the more disappointing. So then the work on the content. What is the discrepancy between it? Whether it's the emotional tone, which the way of the communication is make them to problem or generating the stress. Then you have to reframe about yourself. Whether the other person's emotional interaction, emotional communication, whether it's under my control or it's a modifiable, we have to second question it. Whether what type of the expectance, because we have to take the empathic stand also here. So what my colleague is really expecting from this situation or from this challenging situation. What is he expecting? What is the discrepancy here? Whether if it is that is a solution for me, that's a solution for our interaction. These are the make them to this type of the attitude, this type of the questioning and reframing, and as well as adjusting. These type of the things make them to reduce the vigor of that stress. And suppose, for example, that is the opportunity for us to grow some of the skills also required. Some of the skills also happen with this intense focusing of these interactions. Maybe we other side of the coin we have not seen that. So that's why we have to see, rather than the sometimes the stressful situation, make them to the that is a notice for to raise our skills also.
Dr. Vyas?
I'll repeat a word I said earlier. I'll say, first of all, give a chance. Maybe the difficult doctor is a doctor in difficulty themselves. Okay, organizations will have to approach it that way. But if there is a decidedly difficult doctor, a bully, or a bad person who is causing trouble, a psychopath, if you want to call them, then call them out. If you are calling out eve teasing, if you are calling out harassment, why are you not calling out a bad bullying interaction? Call it out and say, that's not on. You should not be talking and behaving like that. And once you say that, bullies generally stop doing that, because they are trying to do a power structure within the pecking order. So once you call out, they realize that their game is done there. So they would stop doing that. It's a very simple. I'm reducing it for time.
Dr. Anurag, sir.
So the good thing for me is always that Dr. Naveen and Dr. S always cover all the points. I have very little to say. I'm happy about that. There's nothing much to add in this. I think they have covered it all in this. Definitely, if there is a report of abusive behavior or something like that, that has to be immediate. That has to be addressed immediately. It has to be called out. One of the things with people who are troublesome is that I generally tend to call them for a one-on-one chat. And I ask them, what are the difficulties they are undergoing? What is the problem that you are facing? What's happening? Are you troubled by something? Is something going on in your professional life, in the department, at home? If there is something which is there and all, and we can help in some way, I would like to do that. Give them a platform to speak about their own problems. If there are people who are, like very difficult to get along with because of personality or certain traits they have or something, and the one-on-one chat hasn't done anything and all, it hasn't come up, it hasn't yielded any such solutions, then as a team leader or who is heading the department or something, we have to establish boundaries, rules and boundaries, clear boundaries. That, for example, you cannot change another colleague's prescription. Even if you see that patient, because the colleague was not there, you can't just throw out the diagnosis and change the prescription. At best, what you can do is that you can leave a note saying that in your opinion, it is this and this can be done, and ask the patient to come back. Unless there's an emergency, then yes, you can solve the emergency. But otherwise, don't do things like that. Set rules, set boundaries, clear boundaries. And then for people who are really very problematic and who are very intrusive and all that, probably, try to find out the problem, set rules and boundaries. And the third thing is then minimize interaction. That's a last resort. I don't like to do that because it isolates people and it makes them even more bitter and angry. But sometimes that we have to do that, some degree of containment, that we have to protect the other people, we have to protect the department, and so we will have to do that. But I would say that try talking to them first, try to see if we can help them in some way, establish clear rules, and then if necessary, reduce interaction.
So thank you very much, all the speakers, panelists. So Dr. Madhavi, ending, can I have say vote of thanks?
Thank you so much, Raghu, for giving me this opportunity. Our honorable speakers, Dr. Anurag sir, Dr. Naveen and Dr. Vyas, they have delivered an excellent presentation. And most importantly, the question and answer session was very meaningful and interesting. Being a pediatrician and having worked in UK and currently practicing in India, I realized that we have been trained extensively in our clinical aspects of our job, but we have very much less support in terms of how to cope up with our emotional stress. For this, we have to enhance the preparedness among ourselves, our juniors. As most of our panelists mentioned, we should form a group with our psychologists, psychiatrists, and deliver similar training sessions. And the 3 take-home messages today I felt very important for us were, as Dr. Naveen mentioned, we are more prone for distress. We need to understand that. As Dr. Vyas said, we have to accept that we got hurt and try to take time off and recover from that. And most importantly, as Dr. Anurag sir said, we can moan about all this, but we have to be kind to ourselves and we have to set realistic goals. So this is the point I realized from this session today. Though we have crossed our times, I thank one and all for your cordial cooperation. Thank you, sir.
Thank you, one and all. So we're ending the session. Thank you very much. We'll be in touch for the next session for forming the team. Probably we need more help from our colleagues. Thank you, sir. Thank you, one and all.